Hello, and thank you for joining us on the Stay Healthy Knoxville podcast, brought to you by Simply Physio, aimed at helping you live an enjoyable, fit, and healthy life in and around our community of Knoxville, Tennessee. And now, here is your host, Dr. John Mark Chesney.
Welcome, Stay Healthy Knoxville. I'm excited to have on the show Dr. Randy Pardue. Dr. Pardue is a practicing family physician with over 25 years experience in managing the healthcare of hundreds of patients. He was one of the first in the medical community to identify the effect lifestyle habits have on patient health and quality of life. Dr. Pardue is a primary care physician at Trinity Medical Associates and has a growing concern over the high number and increasingly lower age of patients presenting with chronic diseases, along with the need to prescribe more and higher doses of medication to manage these medical conditions. This led to a personal commitment to identify new, scientifically proven methods to prevent, delay, and reverse the development of chronic diseases and transform how American physicians treat chronic diseases. He observed that while medications might improve a patient's lab number, the patient's quality of life often does not improve. In fact, controlling disease often requires the management of more and more medications and their side effects. Equally alarming is the rapidly increasing number of patients developing chronic conditions at younger and younger ages. And thus he developed a prescription-free alternative to prevent and reverse chronic disease called Vital Signs. In 2010, Dr. Pardue co-founded Vital Signs to support his new and transformative process for managing chronic disease. So that's what we're going to talk about here today is reversing chronic illnesses with Dr. Randy Pardue. So welcome to the show, Dr. Pardue.
Thank you, John Mark. Great to be here.
Awesome. Well, I love to start to hear just your story of how you got started in medicine. What was that path? What was that journey for you from the beginning to where you are today?
Well, I really didn't grow up wanting to be a physician. There was no one in my family that was a physician, and when I got to college, I was actually initially interested in dental school, and then I just had a lot of friends that were thinking toward medical school. My roommate was. Just before my freshman year, my dad got pancreatic cancer and was sick for several months and then died. And I think just that experience, seeing how physicians cared for him and just the experience of being with him in the hospital and such just made me think more and more about medicine.
Right. And then, so you got your degree, is it at UT?
At UT in Knoxville, and then my medical degree at UT Memphis.
Okay. Were you raised here around Tennessee?
I was raised in Kingsport.
Kingsport. Okay, so you're East Tennessee through and through. It sounds like.
Yeah. Uh-huh.
Nice. So, so as you got into medicine, did you see yourself going into like the family care? What's been your journey as far as over your 25 years in family medicine?
Pretty much from early on, yes. When I was in medical school, I was focused on the idea of treating sort of the whole patient, whole person, whole families, having long-term relationships, really having just like I've seen in my practice over 30 years, having these very long-term relationships where I get very close to extended families, and then in that am able to have an influence on sort of the whole person.
Gotcha. And then, so I understand we had a conversation earlier preparing for the podcast, and it sounds like that there was kind of like I don't know if there was a moment where you realized that you're kind of the way medicine's being delivered like isn't effective in the way that you want to help. Could you tell us a little bit more about if that was a gradual kind of realization, or if there was just a moment that just kind of hit you, which created this journey in towards Vital Signs?
Well, I think it was a combination of gradual and then some specific moments. In the early 90s, practicing family medicine, we were really, my partner and I were practicing just guideline-based traditional medicine. And so if you take a typical diabetic patient, for example, you definitely would recommend diet and exercise. It's not that we didn't believe in that or didn't recommend it, but we didn't have any confidence that it would make any difference. And so really when you started with the diabetic, you started down a road of starting meds, and it was evident that they're going to end up on 8 or 9 medications. And the more we watched folks, we realized we were, as you mentioned in the intro, that we were treating numbers, so cholesterol, blood pressure, blood sugar. So we realized we were treating the branches and not the roots. So we're putting people on a bunch of meds that sort of prune the branches and didn't do anything to treat the roots of the disease. And so what we realized is that people were ending up on 8 or 9 medications, but we're getting sicker and sicker, and so we, you're thinking, well, are we going to add a year or two to the end of these folks' lives, but usher them along a life of just this sort of gradual decline in functional wellness? And so that just really became sort of a miserable thing to think, well, this is not what I went into medicine for.
Sure.
And so we started thinking about, well, how can it be different?
Mm-hmm. Was this kind of change or shift in mindset, was that beyond just like your experience in your own practice? Was there, people that were shifting towards this way that you'd started to explore to figure out how to change really the way that you're practicing medicine?
At that time,
what time are we talking about?
This is in the early 90s. Early to mid 90s.
Okay.
So other people doing different things. Well, I can give you just one example, and this is one of the things that probably had a turning point. I had this wonderful patient who was a Vietnam vet, and he and I were close. He was really funny, and he was very loud, and I can remember he was sitting. The nurse had just put him in the room. He was sitting in there. And before I even got into the room, he started talking. He said, Dr. Pardue, he said, I'm off all that medicine you gave me, and he said that ridiculous diet you put me on, and I was like, what are you talking about? And he said, well, you put me on that low fat diet, and he said I was just getting less and less healthy, and you have me on all this medicine. He said, I started the Protein Power Plan, and it was a diet that was popular in the 90s, along with the Adkins and others that came from a husband and wife medical team named the Eads. And he had gotten I think it was off an infomercial or something. He had purchased this diet and had followed it, fairly closely, it seemed, and just told me. He said I stopped all your medicine, and I said, well, okay. I said the truth's going to be in the numbers, and so I said, look, we better check your numbers and see what's going on. So quickly realized he had lost about 30 pounds, and his blood pressure, when we checked it, was actually normal off medication. And then I said, well, your cholesterol is going to be sky high. This is going to be awful. Your sugar is going to be bad and such. And so when we got his numbers back, his glucose was virtually normal, and his triglycerides had gone from, in the 300s down to under 100. And so what that did was it didn't make me say, oh gosh, the Protein Power Plan is the answer, but it made me say, wait, there's something remarkable happening here in his physiology, and I need to explore it.
Sure.
So that started a huge journey there.
Well, I love hearing that too, just, being also in healthcare, we call it a practice for a reason, and because we're always practicing, and having a provider like yourself that's sounds like is humble enough to like admit, like, hey, I know a lot, but I don't know everything, and let's see how I can continue to refine and improve. And even when you have a patient that's coming here and say, I stopped everything you told me to do, and now I'm getting better. But to take that not as like offended, I think a lot of providers could take that in the wrong way and never use that as a moment to really grow and learn and to better themselves.
Yeah. Well, what that did was it again, like I say, I didn't suddenly shift my practice, but what I did was I started doing some research.
Sure.
It just fascinated me. I thought, well, what is happening here in his body that his blood pressure dropped like this, that his sugar dropped, that his triglycerides dropped? So one of the things I did is went back and read the metabolic sections of my med school physiology text. And what I realized is that we had been taught accurate physiology that could have been applied in this way, but then when we had a nutrition course, we had been taught complete nonsense. And so it was just, the physiology didn't translate how we were practicing.
Right.
So
yeah, I think that's, interesting. I grew up in the 80s, but it was, the time of the low fat everything, know.
Yeah.
Like I just remember when, I would look at the label, and I was, I guess, always a little bit of health conscious, but how a product is good or bad is by just looking at how much fat it has in it.
Absolutely,
And
yes.
that's what we were taught in school, and even just how the food pyramid, was at the time, and as far as the guidelines for nutrition. And and then recognizing now, that was the common preached, as far as diet guidelines, and that there's a complete shift of understanding with that now.
Absolutely. And that was really based, the interesting thing to look back on that, it was based on really bad science. It was based on epidemiology, which did great for getting rid of infectious disease epidemics and that sort of thing. But for multifaceted issues like nutrition, it just doesn't work. People are given these surveys and ask, what did you eat last year, in essence, and they fill out a survey, and then they fill one out every 4 years, and then they presume to generate data from that. And it really, literally, at best, generates, what we call correlation. So these two things go together, but they try to get like real legitimate scientific answers. This causes this, And so so I think that's one of the issue with low-fat diet was just really from the beginning very bad science.
Yeah, so it's great to hear that even the personal example of your client, a Vietnam vet, going through that process. So it sounds like you started really diving in to the research, and then what was kind of that next step? Like, what did you find like as you dove into the research, and what did that bring you to next?
Well, what we really, I would say, what we began to notice when I talk about treating the roots, it's this issue of what we call metabolic syndrome. So it was, what we began to look at is that a huge portion of our population and a huge portion of the disease that we saw, so heart disease, and then everything that sort of went with that, with high cholesterol, high blood pressure, but then, every kind of vascular disease, strokes, losing limbs, losing kidneys, going blind, everything that went with this kind of chronic disease had roots in what we call metabolic syndrome, which was, it was tied with their population eating just really bad processed food. So bad processed food with too much processed starch, too much sugar, bad fats, which are really basically, fats made in a chemistry lab, if you will, sort of corn oil, things like that, high fructose corn syrup. So we saw that all these things that were in bad processed foods were leading to what we call insulin resistance. I mean, there's sort of a long explanation here. I don't know if I should go into it, but the bottom line was that, but at the roots, folks were not, they couldn't tolerate glucose, and their muscles were resistant to insulin, and so then there's sort of this cascade of fat cells fill up and can't empty. We can't utilize glucose or fat properly for energy. Our triglycerides go way up in the bloodstream. Our blood sugar then begins to go up. Our blood pressure rises because if we have high insulin, we hold on to salt. So it's just a whole cascade of things were going on that then when you begin to look at the big picture, it contributed to chronic disease. And again, when I look back in my medical text, this stuff was in our medical text back in the 80s.
Mm-hmm.
So it wasn't any like new information. It's just that we had not been applying it.
So you kind of continued on this journey as far as what a lot of people has probably experienced when in medicine or family practice is kind of what you described before is receiving, going in with some sort of symptoms and coming out with a prescription, some sort of medication, and then with your clientele you're working with, it's not like you're really getting back to the roots of probably what physician practice looked like, for our parents, as far as when we didn't have all this medication developed and looking at different changes, behavioral changes, right?
Vital signs came out of really our, I would say, earlier failures to get folks to do this, make the sort of changes that we wanted them to make to address, again, the root cause of disease. So again, when we began to realize that we weren't helping people by putting them on all these medications, and we began to see some of the sort of correct ways to apply diet and exercise and things like that, we still realize that just working with the patient in the office, so if I just gave someone a handout or a list, do these things, or if I even just sat there and spent a good amount of time giving them accurate information, I found that very few people, now there were a few, I'm not saying none, but so a few would apply it and come back and be changed, but still what I realized is that most people need just a lot more hands-on. That I found there's this principle that's sort of built into the universe called discipleship. And people need, how do I say this, sort of social engagement. They need a mentor to not just tell them what to do, but then walk along with them and sort of show them what to do. And so that's where we started thinking about how can we structure that into programs. And that was sort of the origin of Vital Signs is we really started out with a 12-week program where we met 3 times a week and exercised, and then also had group-based learning. And then it sort of evolved from there, and out of that we've developed, I think we've learned a lot about effective teaching, how do you teach things and get them to stick. And then we've learned a whole lot about behavior change and just the different things we apply, both in groups and individually, that really help people to sustain behavior change.
Sure. Well, we're going to take a break to hear a word from our sponsor, and then when we come back, we're going to be diving more into Vital Signs and hear from Dr. Pardue as far as how they specifically work with clients that are looking to change the way their health without being on medications or that being the primary route.
Stay Healthy Knoxville is sponsored by Simply Physio, a physio clinic that equips and empowers you to live your life to the fullest so that you can enjoy the things you love to do and be the person you are made to be. Simply Physio specializes in helping people get back to a healthy and active lifestyle, living free from pain and medication and avoiding unnecessary surgery. Stay tuned until the end of the episode to receive a special gift from Simply Physio and enjoy listening to the rest of the episode.
Well, we'll come back to the podcast. If as you're listening here and talking about chronic illnesses, maybe you specifically don't have a chronic illness, but I know that you know somebody that does, maybe a loved one, family, or close friend. And just to read some statistics, more than 29 million Americans have diabetes. That's 1 in 4 don't even know it. More than 1 in 3 Americans have pre-diabetes. 1 in 3 children and adolescents are overweight or obese. And the most significant increase in pre-diabetes are occurring in women between the ages of 20 and 39. And we know also just in the state of Tennessee, in our region, that the number of prescription medications that people are on and as where we rank in just weight and overweight, that we as a state rank in the lower, the higher, the one of the worst there for the state. So yeah, Dr. Pardue. So there's obviously plenty of people that need this type of help. Just wondering, like, as you've continued to pursue into this area of medicine, like what are some of the obstacles that you've occurred as far as helping people to get on the train and really start to really do the hard work?
Well, first of all, I'll just comment on the statistics. It's interesting. The some of what you read was pulled from our website there, and I think literally since we've put that on the website just a few years ago, things have gotten actually worse. And I think we really are. We're moving to a time when probably more than 50% of Americans are having metabolic syndrome, for example. And so this is literally it's a societal, cultural disease that's based on really our food supply mostly, and then some other things thrown in. But it's just literally most of us are going to have this problem, and it's a problem that literally cannot be dealt with by traditional means. So it has to be dealt with by changing the specific behaviors that cause it. So obesity in the probably before 1980, I think we were talking 15% or less, and now we're getting up to the over 50%. It's going to be a majority. Yeah. And so what are other means that we can help each other? And I think that there's a huge community influence here. And I've just found, for example, that a fellow physician that is on board, it just popped into my mind a couple of local ophthalmologists that are just really on board with us, and they've learned about metabolic disease, and specifically you can imagine from the effect of diabetes on the eyes. And so then they become, when our patients go see them, they really enhance what we're doing, because they say, hey, you're on the right track, your eyes are looking better, you're doing the kinds of things that will preserve your eyes. So we find that the physicians that support us and support the process make a huge difference. And by the same token, there's still physicians that, and I can hardly blame them, but are just still intent on these sort of traditional guideline-based methods. And I have had doctors tell my patients, why are you struggling with all this? Just do bariatric surgery. I've had others immediately start my patients on several meds, which has then caused a discouragement in them in the process, and then they have not continued their process of change, and because they begin to focus on this idea of, well, medicine's going to make me healthy.
Sure.
And so so I think there's a huge element of the more sort of people get on board with how people can really be healthy, then we can work together as a community on this.
Years ago, like if somebody had asked me, like, is diabetes reversible? And, my understanding of the illness is once you had it, then it was just managed,
Yes.
Through medication primarily. And that was my understanding. And so, I think there's a real need for not just the medical community, or not just the community at large, but also the medical community, just to understand that, no, this is, this is created, often by behavioral choices, influence, but it's also reversed as well by, changing behaviors as well.
Yeah, absolutely. The typical idea of diabetic education was really educating folks into the idea that you have a chronic disease. It must be managed. So we would emphasize things like checking your blood sugar on a regular basis, and making sure you take your medications, and here's what this chronic disease will do to you. Here's the process, but we can slow it down. If you've got diabetes, you're eventually going to end up on insulin, but let's hold that off. So it was all that idea, and so you can imagine you inculcate a sick mindset. Like, I'm a sick person. I need meds to sort of manage, and so it's really it's a radical concept that we, rather than going down a road of being on 8 or 9 meds, we want you to be on 0 meds. We don't want you on any medicine. So that's, you can imagine that what a different way of educating that is.
Well, maybe take us through, like, let's say you have a patient, someone reach out to you and say, Dr. Pardue, I have, diabetes or some, chronic illness and metabolic illness, and I want to get off these meds. Help me. Like, what do I need to do? What's my first step? What's my second step? And tell me the process.
Well, I'll start out just educating them from my point of view and tell them what I've learned about it and encourage them that it's a reversible process. And then I really try to, from a doctor's standpoint, explain why I don't think they have to be on say, for example, a statin drug immediately or a glucose-lowering drug immediately. So in other words, I try to use whatever trust they have in me or the authority I have as a physician to really get them comfortable with the idea that drugs aren't the answer, so to speak. And then just talk through the steps I think we can take related to diet, exercise, sleep, stress that will really make a difference, and then talk to them about, well, how are we going to proceed with that? And one of the first things we often do is that we have in our office trained some of our nurse practitioners and PAs to do what we call medical nutrition therapy, where they just right there in the office start the process of a more intensive education. So it allows them to have for example, a whole hour or so for the first visit to really begin the intensive education. And then sort of from there, then the process of getting over to vital signs for the more intensive group programs, which include, again, so not just instruction on nutrition, but intensive work with behavior change, what we call functional exercise, which is sort of exercise designed to, I'm sure much like you teach your patients,
sure.
Exercise for their life, the kinds of things that will literally make a difference in the movements they do every day. But specifically along those lines, exercises that are designed to affect the process of insulin resistance in muscles. So, for example, we want them to really work out their muscles and get stronger because that's one of the things that reverses diabetes. So it's working with me as a physician, then getting with other parts of our staff, and then getting over to vital signs for the real intensive work of change.
Sure. And it sounds like you guys have created a real community support to assist people on various levels, group support, trainers, nutritionists.
Absolutely.
To help guide those steps, because the solution sounds pretty simple.
Yes.
Right?
Yes.
But then the execution of the simple recipe is the difficult part, which people struggle with, right? And so it sounds like you've really designed a program that understands the success rate of just giving somebody the guidelines on a sheet of paper doesn't help.
Well, and one of the interesting things is that if you think about, like, I can readily think of, for example, one patient told me that his insulin cost, a specific kind of injector that he had, cost $600 per month. And so it's very common now for our insulins to cost just outrageous amounts. Or I can think of some of the other newer type 2 diabetes meds that readily cost $200 to $300 a month. So people have high deductibles, so they're paying a lot of this out of their pocket.
Mm-hmm.
Well, we have so our program, one of our main programs at Vital Signs is called Launch. That's diabetes reversal. Costs $500 for a 10-week program, and in the process of that program, almost everyone gets off at least most, if not all, their medicine. And it's interesting that people will still say, and they are so used to saying, well, does insurance cover it? But for various reasons, they'll still balk at $500, yet pay all this money for these meds.
Mm-hmm.
So also is just to get people really just thinking differently about how you get healthy.
Right. And what is it, what kind of lifestyle are you looking, to live? Is the with the course that you're on, are you going to be happy with that? And what is that worth to you, right?
Absolutely.
Yes. Yeah, and I saw a comic recently about two doors, and there was one of the doors on the door that said, like injections, prescription medications, surgery, and the line was out the door, and then the other door said behavioral changes, and there was like one person there. So that's the challenge, and that's the field that I work in too. Is I'm want to help people to avoid going down the route of just masking symptoms with pain medication or injections or surgery, and then asking what I say is the better question of like, why is this gone bad in the first place? If we answer that question, which you're doing as well, is if we figure out why the metabolic system has gone haywire, and we, address it at that level, then we're going to really, have the right solution and create longevity, as far as improving somebody's quality of life.
Yes, absolutely. And one of the things is this idea of we've just almost accepted this idea that at 50 years old I feel terrible. So I wake up in the morning and I'm achy and I'm stiff and I have my energy's dropping, and it's just aging. And so what we're thinking about is you don't have to go into that decline, and this idea of squaring off the curve where obviously we're all going to die, but we don't have to be in a chronic decline before that. And a lecture I heard in the 90s that was one of the ones that really set me on this path was the guy said, he said, my goal is that when I'm 90 years old, I'm going to be snow skiing with my great-grandkids and run into a tree and die.
Here you go.
So we don't have to chronically decline and then just have this sort of expensive, long-term, sort of miserable existence.
Sure. Well, great. Well, want to transition here just into the 5 questions that I like to wrap up the episode with. As far as highlighting Knoxville, Dr. Pardue. So the first question, what is something on your Knoxville bucket list, East Tennessee, that you're itching to get out and do, explore?
I'm not going to give as much as one that's a personal experience bucket list. It's something I'd like to see happen and be involved with in my lifetime. We do a lot of work in the inner city, and I would love, and one of the things we see is these metabolic diseases are very much accelerated in that setting with the sort of in lack of availability of healthy foods and just many other things that go with that. And so we're seeing these kids under 10 that are developing diabetes and just extreme obesity in very young ages. And so one of my bucket list things is for us to figure out how to apply our vital signs methodologies and the things we've learned in that setting.
Sure, for the children that don't have those resources.
Absolutely,
that's great.
Yes.
Well, if Dr. Pardue had a day off, had a evening, afternoon, just to do something that he likes doing around here in Knoxville, what would it be?
Gosh, I'm thinking of several things. My wife and I lately have been absolutely loving to go over to Lakeshore Park and walk around the loop over there. If people haven't been there and seen it, it's just they've done so many things to enhance it and make it beautiful and put benches to sit on and picnic tables and just going by the river there. It's just absolutely beautiful now. And so that's a resource in Knoxville that I think hopefully more and more people will take advantage of.
All right. And if you were taking your wife out on a date, maybe a favorite restaurant, where would you guys be going to?
I don't know if it's my favorite, but if when we go walking at Lakeshore, we then like to stop by Zoe's Kitchen there on Bearden Hill, and it's just, it's fresh, healthy food. It really tastes good.
Mm-hmm. Yeah, my wife and I like Greek food. That's one of our like if we had to pick one style of food, it'd probably be Greek food too. Your best tip for staying healthy, Dr. Pardue?
Wow, it's a hard one to boil down, but I think a lot of it comes down to mindset, and that's just that sort of why do you want to stay healthy? And I like to think of it in terms of stewardship. God gave me a body, and I want to take care of it, to do the things He has for me to do, and to just have joy in doing those things. And so I think when I start from that mindset, it also keeps me out of a lot of the sort of obsessive thinking we hear in wellness that just that I think, frankly, increases stress and causes other problems. So just a mindset of stewardship, and then from there become educated of what are good foods to eat, what are good exercises or good movements I can do, and that sort of thing.
Great. Well, for our listeners, if somebody wants to explore the vital signs and get more information, what's the best way for them to get in contact with you?
They can call my office at Trinity Medical Associates at 539-0270, or they can call down to, they can look up vitalsigns.com vitalsignswellness.com, and get all the information they need about direct contact with Vital Signs. We love to have people not just from our medical practice, but from all over contact us and come do our programs and see what we have to offer.
All right. Well, I know we've sounds like just even scratched the surface, and this is a great topic. And thank you so much for coming on the show and spreading your wealth of knowledge to our community.
Absolutely, John Mark. Thank you so much for having me.
All right. Stay healthy, Knoxville.
Thank you for tuning in to the Stay Healthy Knoxville podcast, brought to you by Simply Physio. If your pain is preventing you from staying healthy and active, and you'd like to avoid surgery, pain medicine, or just want to get back to doing the things you love in and around Knoxville, we offer both a free ebook and free over-the-phone consultation to help you figure out the root cause of your pain and the next best steps for resolving it. Find our ebooks online at simplypt.com/health-tips. There you will find ebooks for topics such as neck and shoulder pain, lower back and hip pain, knee pain, and TMJ. These quick-to-read reports will provide you with expert tips, tricks, and exercises to help solve your pain from the comfort of your own home. Just visit simplypt.com/health-tips to download your ebook and have it delivered directly to your inbox. We also offer free, no-obligation phone consultations with a doctor of physical therapy to Knoxville area residents. Just call us at 865-351-0615 or visit us at simplypt.com and click the Talk to a PT button on the home page to schedule a call with us. Thanks again for joining us, and we will see you next time on the Stay Healthy Knoxville podcast. This has been a Humble Pod production. Stay humble.